Welcome to the Victory Education Lounge. I'm your host, and today we're diving into a critical topic that affects millions: fibromyalgia and insulin resistance. This is part 106 of our ongoing series on metabolic health. Before we begin, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this vital information. Did you know there's a significant connection between fibromyalgia and insulin resistance? Unraveling this relationship can be a game changer, especially for those dealing with chronic pain or managing insulin resistance. Even if you're someone who's merely aiming to optimize your overall health, understanding this link is crucial. In this video, we're going to delve deep into how insulin resistance influences fibromyalgia. We'll shed light on the various aspects of fibromyalgia that are affected by insulin resistance, such as pain sensitivity, sleep disturbances, fatigue, cognitive function, and more. And we won't stop at just understanding the problem. We're also going to discuss solutions, management strategies, and prevention methods for each of these issues. So whether you're a health enthusiast, a patient, or a caregiver, there's something for everyone in this discussion. Stay tuned as we delve into this important topic. Before we jump into the connection, it's crucial to understand what fibromyalgia and insulin resistance are. Let's start with fibromyalgia. It's a chronic disorder characterized by widespread musculoskeletal pain, often accompanied by fatigue, sleep disturbances, memory issues, and mood swings. It's a complex condition that affects millions, with symptoms that can vary greatly from person to person. Now let's talk about insulin resistance. Insulin is a hormone that allows your body's cells to take in glucose for energy. When you're insulin resistant, your cells don't respond well to insulin, which means they can't easily take in glucose. This results in high levels of glucose in your blood, leading to prediabetes or type 2 diabetes if left unchecked. So how do these conditions intersect? Well, research suggests that insulin resistance can worsen fibromyalgia symptoms. For instance, insulin resistance can lead to increased inflammation in the body, which may exacerbate the pain associated with fibromyalgia. Additionally, high blood sugar levels can disrupt sleep patterns, contributing to the sleep disturbances common in fibromyalgia patients. Even cognitive function, often referred to as fibro fog in fibromyalgia patients, can be impacted by insulin resistance. It's also important to note that a lifestyle that promotes insulin resistance, characterized by a diet high in processed foods, sedentary behavior, and high stress levels, can also contribute to the severity of fibromyalgia symptoms. It's a two-way street, with each condition potentially exacerbating the other. The good news is, by managing insulin resistance, we may also be able to alleviate some of the symptoms of fibromyalgia. This includes strategies like adopting a balanced, nutrient-dense diet, engaging in regular physical activity, managing stress, and ensuring a good night's sleep. Now that we have a foundational understanding, let's explore the significant ways insulin resistance affects fibromyalgia. Insulin resistance can increase inflammation and pain sensitivity in fibromyalgia. This is a crucial understanding as it directly affects the way we approach managing this chronic condition. When insulin resistance is present, inflammatory responses can spike, leading to heightened sensitivity to pain. This can exacerbate fibromyalgia symptoms, making daily life even more challenging. So, what can we do about it? 3 key management strategies are worth considering. First, adopting an anti-inflammatory diet can help reduce inflammation levels in the body, thus potentially reducing pain. Second, keeping blood sugar levels under control can help manage insulin resistance, which can in turn lower pain sensitivity. Lastly, regular gentle exercise can help improve insulin sensitivity, further assisting in pain management. It's important to remember that these strategies may take time to show results. They require commitment and patience. However, with consistency and dedication, they can make a significant difference. With these strategies, managing pain sensitivity caused by insulin resistance can become more manageable. Insulin resistance can also exacerbate sleep issues common in fibromyalgia. It's no secret that a good night's sleep is pivotal for overall health. But for individuals grappling with fibromyalgia, it's even more critical. When insulin resistance enters the picture, it can disturb sleep patterns, leading to increased fatigue and pain. So how can we combat this? First, establishing a consistent sleep schedule can help regulate the body's internal clock, aiding in better sleep. Second, stabilizing blood sugar levels before bedtime can prevent sudden spikes and crashes that might disrupt sleep. Finally, practicing good sleep hygiene, such as creating a sleep-friendly environment and limiting exposure to screens before bed, can further enhance sleep quality. Remember, a well-rested body is better equipped to manage pain and other fibromyalgia symptoms. By addressing insulin resistance and implementing these strategies, improving sleep quality can make a significant difference in managing fibromyalgia symptoms. Fatigue is a common symptom in fibromyalgia, and insulin resistance can contribute to this. When your body isn't responding effectively to insulin, it can lead to a cascade of metabolic disruptions. One of these is an irregular energy supply leading to fatigue. This chronic tiredness can be debilitating, affecting your ability to carry out daily activities and enjoy life, but there's hope. Managing insulin resistance can make a significant difference. It starts with balanced, low glycemic meals. These can help regulate your blood sugar levels, preventing the energy crashes associated with high glycemic foods. Next, consider a gradual increase in physical activity. Exercise can improve insulin sensitivity, but it's important to start slow to avoid exacerbating fibromyalgia symptoms. Lastly, stress reduction techniques such as mindfulness, yoga, or meditation can help. Chronic stress can worsen both insulin resistance and fibromyalgia symptoms, so managing it can yield multiple benefits. By managing insulin resistance, you can significantly reduce fatigue and improve your overall energy levels. Insulin resistance may also contribute to fibro fog or cognitive difficulties. This is a common symptom of fibromyalgia, characterized by memory problems, difficulty concentrating, and confusion. Now, why does insulin resistance factor into this? Well, when our blood sugar levels fluctuate, it can impact our brain health and cognitive function. So how can we manage this? First, a brain-healthy diet rich in omega-3s can provide the necessary nutrients for optimal brain function. Foods like fish, walnuts, and chia seeds are excellent sources. Secondly, regulating blood sugar levels is crucial. This can be achieved through regular meals, avoiding processed foods, and incorporating physical activity into your routine. Finally, don't underestimate the power of cognitive exercises. Activities like puzzles, reading, and even certain computer games can help keep your mind sharp. Remember, the goal here is to improve mental clarity and cognitive function. Improving mental clarity can greatly enhance quality of life for those with fibromyalgia. We've covered several ways insulin resistance impacts fibromyalgia and potential solutions. It's clear that the connection between these two conditions is significant, affecting various aspects of fibromyalgia symptoms, from pain sensitivity to cognitive function. First, we discussed how insulin resistance can increase inflammation and pain sensitivity in fibromyalgia. The management strategies we highlighted include adopting an anti-inflammatory diet, controlling blood sugar levels, and incorporating regular gentle exercise into your routine. Next, we delved into sleep disturbances, a common issue for those with fibromyalgia. Insulin resistance can exacerbate these sleep issues, but strategies like maintaining a consistent sleep schedule, stabilizing blood sugar before bed, and practicing good sleep hygiene can help improve sleep quality. Our discussion on fatigue brought to light that insulin resistance can contribute to the exhaustion often experienced in fibromyalgia. Balancing meals with low glycemic foods, gradually increasing physical activity, and implementing stress reduction techniques can help combat this fatigue. We also explored the cognitive difficulties, or fibro fog, often associated with fibromyalgia, which insulin resistance may exacerbate. To manage this, we suggested a brain-healthy diet rich in omega-3s, blood sugar regulation, and cognitive exercises to improve mental clarity. Our conversation about muscle function revealed how insulin resistance can affect muscle metabolism and function in fibromyalgia. Gentle resistance training, adequate protein intake, and blood sugar management can help improve muscle strength and reduce pain. Finally, we touched on mood disorders. Insulin resistance can contribute to mood swings and depressive symptoms in fibromyalgia. To manage these symptoms, we suggested regular physical activity, a balanced diet, and mindfulness practices. Understanding and managing insulin resistance can significantly improve fibromyalgia symptoms. These strategies might require some lifestyle changes, but the potential benefits for your health and well-being are considerable. Thank you for watching, and we look forward to joining you in the next video. Remember, managing fibromyalgia in the context of insulin resistance requires a comprehensive approach. By addressing both conditions, you're not just managing symptoms, you're supporting your overall health and well-being. Thank you for joining us in the Victory Education Lounge. Don't forget to like, subscribe, and share your thoughts in the comments. Your experiences could help others on their journey to better health. Disclaimer: the information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decisions, especially those related to fibromyalgia and insulin resistance, should be discussed with a licensed physician or qualified healthcare professional.